osteopath from Sports and Spinal Clinic. I want to answer a question. Sitting in this position here, and you can see the one above it where the red area is poking out, that is a herniated disc. Now, there are a couple of factors as to whether or not how likely it is to heal on its own. The bigger the herniation, which is the bulge, the more chance of it has of recovering, which is probably different than you might have expected. You might have thought if it's a small one, it'll probably heal, and if it's a big one, it might not. Well, the opposite is the case, because if you have a big herniation, the bulge is recognised by the body, and the body sees this as foreign material, so it will have a really good healing response. Now, so if you have a little bulge, now you don't know this unless you've had an MRI, but if you have a little bulge, then it may be a little bit of a problem because the body doesn't see it and doesn't recognise it, and therefore it's harder for it to recover. So size of the bulge is important, and bigger for this is better to recover. The second factor is also how much wet material you have in a disc. So a healthier disc will be fully hydrated and really spongy. So you'd expect a young person to have a really hydrated disc. And as we get older, there's been more compression on the spine, and the disc is getting drier and becoming, so on an MRI you'd see that as a blackened area rather than a white vibrant area. So the more wetness in the disc, the more movability and the chance of it healing as well. So ideally you want a large disc protrusion or a herniation, and you want a wet disc as well. So these are factors which we use to work out whether or not someone is likely to get better with treatment, or whether or not they would go on to require further intervention. So if you're struggling with a herniated disc, we've got a little information pack there, and I'll link, and you can find out a little bit more about how we might be able to help. Okay, thank you.